Okay.
Yeah,
All right.
thanks.
So here's the CT scan we just took for you. Okay.
Is it rolling?
Yeah.
Yeah. Look at the date, 10/12/2020. Okay.
Yeah. Okay.
It has your name on it, Angela Gabriel. Okay. So we're gonna look at different things. Okay. One thing that we look at is the spine. Your spine is too straight here. It's too straight. All right.
Okay.
You want to have a little bit of curvature to the spine. Okay. So just a little bit of a normal curvature. We're seeing you losing that a little bit.
Okay.
That's often a compensation for these airway issues, because what you do is you put your head forward
Yeah.
and then up like this. Okay.
Yeah.
So your spine is too straight. It should have a 38-degree arc to it. All right.
Okay.
So we're seeing that there's not this 38-degree arc, right? It should be like a little suspension like that, and it's very straight. Do you see that there?
Yes.
That's number one. All right. Number two is that your posterior airway space. This is your tongue. This is your upper jaw, lower jaw, upper jaw. This is your spine. So posterior airway space, pharyngeal space, is the amount of space you have in your pharynx. Is this making sense
Oh
at
yeah.
all?
Oh yeah.
So we measure this out, and here, right behind the mandible, your airway is 3 millimeters. Okay. Right here behind the tongue, your airway is 4 millimeters. Right here behind the soft palate, your airway is 5 millimeters, and then retromaxillary, it's not bad. This is kind of where it should be, 1 centimeter. Okay, so
It should be like that all the way
all
down.
the way down,
Ah.
all the way down. Okay, when you have a restricted airway, you have to put your head forward and up in order to breathe.
Yes.
If you were there, come away.
Oh, I know.
Okay.
Yeah, yeah.
So what you do is you put it up, but you want to see, so you have this awkward high tension position,
Yeah.
fighting the spine. All right.
Yeah.
Does that make sense?
Yeah.
All right. So we can also see that you've had some root canals here, often consistent with clenching and grinding.
Yep.
Okay. So we see you've had Genioglossus Advancement, but not like not that. I mean, maybe you were worse and now you're better, but still not enough. Okay.
Yep.
So let's take a look at this image here. All right, your ear canals look good. Everything looks good from there. Okay. Spine health otherwise looks good here. We're looking at everything here. Okay. I mean, nice. You probably did some physical. Very symmetric. Very good. All right.
That's good.
So good that you're working on that or not. Okay.
Yeah.
She's been working on it, haven't you?
Yeah.
She has, huh? Good.
Yeah.
It shows. Okay. So front of the nose. All right. Here is your. So you're having inflammation inside here. So we're gonna probably.
Which side is that?
This is your right side.
Oh yeah.
Okay. You've had sinus surgery, but you have plates in there. Okay, and the plates are extruding through here and causing inflammation. Are you seeing that here?
Ah yes.
Okay, so it's a nidus of bacteria here, and bacteria form something called a biofilm. So the bacteria link up hands so they can hold on tight. All right. The best way to break up bacteria biofilm is either with saline rinse plus xylitol.
That's what I love that.
That's great.
Yes.
That's great. But if it's still not working, you do saline rinse plus xylitol plus or Baby Johnson shampoo. Did we try that here today for her or no?
Yes.
So Baby Johnson shampoo is like a shampoo,
Okay.
and it breaks down so it's not as sticky. Okay.
Is it okay to put my hand here?
Sure. Yeah.
Sometimes the doctor who did the surgery 30 years ago, I would put Bactroban, not the nasal Bactroban, but like a topical Bactroban.
So Bactroban is antibacterial.
Yeah.
But what we've learned is that you actually want to have bacteria in your sinus.
Okay.
You want the good bacteria.
Sure.
So we don't prescribe so much of antibiotics anymore.
I see.
We rather provide the xylitol so good bacteria can grow.
Yeah.
And then if it's overly inflamed, the inflammation kills the good bacteria.
Yeah.
So we bring in budesonide rinses temporarily for a couple months to calm down the inflammation. And then there's also things you can buy, different kind of fungus and bacteria you can put into your nose, like little capsules of
Like
it on
probiotics.
Amazon. Probiotics.
Yeah.
Okay. And then it restores good bacteria. Because if you kill the bacteria, you're killing the good bacteria.
Yep.
Right.
And the bad bacteria can survive. So
Yeah.
you want to overpopulate with good bacteria. That's the strategy we use.
That's
Great.
excellent.
Great. I like that.
Yeah.
So I actually have an appointment with the surgeon next week. I was going to ask him about getting those plates removed.
So if you have a revision surgery, so this is a complicating factor.
Okay.
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 Because you want to figure out: are you doing another MMA? Are you not? Are these plates going to be removed? You probably have to remove these, let it heal, and then do the MMA. Okay, but I don't know. I don't know.
Okay.
I'm not, not there yet. Okay, so now we're going to measure intermolar width. Okay. You do look narrow, actually. Okay. So inner molar width. Okay. This is your second molar here. We measure inner molar width at the first molar, which is this one. All right. So we go ME junction to ME junction here. Okay. And you're very narrow. Very narrow.
That's what I thought.
Yeah. Very
That's why
narrow.
you can't fit your tongue in there.
3 centimeter inner molar
And what
width.
should it be?
4.
Oh my God.
Yeah. So you're very narrow, and that's probably also why you're having sinus disease. So I agree with MSC. First off, I think
Can you get a whole centimeter of expansion?
you need to use 2 expanders.
That's what I was wondering.
Yeah, you need to use 2. Okay. So is the tooth? Do you have enough bone? What do they mean by that? Okay.
Yeah.
You see how this is the tooth?
Yeah.
You see how this is the bone?
Yeah.
Okay. So the tooth has to be covered in bone at all times.
Yes.
The tooth comes out of the bone, then
Then
it's
you're
like
in pain.
No, well, the tooth's out of the bone.
You lose
You
your
like to
tooth.
lose the tooth. Yeah,
Yeah.
you lose the tooth. As it's coming out, maybe you have pain. Okay. So here, okay. So here's the thing. Okay. Here's the thing. Here's why they say you don't have enough space.
Yeah.
Let me tell you why. You're already the top can only be 5 more than the bottom. 5 millimeters more than the bottom. This is a lid on the container. The lid can't be like a
Right.
centimeter bigger than the bottom.
Right.
Then it's like this and it's like that, right?
Won't
Yeah.
be able to chew.
Like,
yeah.
that's not going to work, all right? So what they're saying is that the bottom teeth, look, this is the bottom tooth. It's already at its limits.
Yes.
So if we pull this 1 centimeter more, that means 5 millimeters more this way, right?
Yeah.
And 5 millimeters more this way, okay? That's what you would want, right?
Yeah.
Then how are they going to get it to match the bottom?
Right.
Okay, it's like you're way off. So that's what they're alluding to here.
Yeah.
There is a procedure. It's called surgically facilitated orthodontics, a periodontal surgery, in which they add bone here.
Yeah. Do they take it from your hip or
No, it's
like cadaver bone?
Is it cadaver or cow? Something like that. I don't
Okay.
know, but it's a bone matrix or it's synthetic. I don't know how they make it exactly. But they open up the gums. They scrape it up a little bit. They put all these like totally safe biogenetic materials in your mouth,
Wow.
and then bone grows. It's like a platform, and then your own bone grows into it. Okay.
Wow. Okay.
So I don't want you to think you can have cadaver bone inside you. It's not like that.
How long does that take?
What does that mean? In what kind of measurements?
Light years?
No, like it's like a surgery. You have it, and then you heal, and you're healed by 2 or 3 months.
Okay.
I think
3 months.
how long does it take for the bone to actually grow
Into it.
into it?
Like
how long would it be
Not
before-
more than 6 months.
Okay. And then after that, then you can expand?
Then you can pull the teeth. No. So you can expand. Like so they put the bone graft and they pull the teeth out with it. Like it's remarkable.
Oh, wow.
Yeah, it's remarkable.
Wow.
Yeah, it's called surgically facilitated orthodontics. You do ortho right away with that.
Wow.
It's really cool. Okay,
Okay.
but you got to go get a consult from a periodontist or a surgeon. Okay.
Okay.
So that's called SFOT. So which one do you do first? All this and that, right?
Yeah.
So people in general say to do the MSC first,
Yeah.
and then the SFOT with braces to fix everything.
Can you do MSC when I still have plates and screws?
So you have to do MSC with surgical assist, which means that you have to use surgery to cut the bones.
Oh, okay.
So one treatment that might be good for you, okay, if your head is the following. Number 1, MSC to widen you where you need to be.
Yeah.
Okay. But at the time of the MSC installation, remove the hardware. Okay. Make the cuts, remove the hardware, let it grow. All right.
Yeah.
And then you come in, you do periodontal surgery on the top and the bottom. Okay. And that'll heal all the periodontal issues. Make sure you have bone everywhere that you need. Get your occlusion right. And then step 2, MMA. Step 3, MMA. Okay. So that would be the most ideal treatment plan for you. Step 1, MSC, removal of hardware, surgical assist. Step 2, SFOT. Step 3, MMA. Okay. I know you don't want to hear this. Okay. It's possible that MSC alone would give you enough tongue space, because when you get the MSC, the tongue can kind of go this
Yeah,
way.
yeah.
And maybe that'll be enough that you don't need to redo your MMA. Okay. Let me measure this out. We're looking for a 97. No, you're still not projected enough. Okay.
Yeah.
8.6.
And how much should it be?
9.7.
Okay.
Okay. And here's another way. So this should be like there. Yeah, it's not, and then so when they do that, they also rotate it. You get your spine curvature back, so your spine should curve.
I
up.
asked him about that rotation, and I don't think I got any rotation when they did the surgery. I think it just moved forward because that whole counterclockwise
Yeah, right.
thing.
Yeah. That's kind of it's where we're at. It's all good. What are you gonna do? You know?
Yeah.
So that's kind of what we're talking about. This is just information I'm giving you. You don't have to act on it. Let me take a look
Did
here.
you get those pictures that have the rainbow colors that show
the airway airway measurement?
Yeah.
I know Dr. Coppelson has that on his report. I don't have that Nanomodge software.
Okay.
It doesn't work on this computer.
It's cool looking.
it is cool looking, yeah. But it would be constricted for sure. So the cross-sectional area is going to be...
So where it says 5.4 millimeters, that's supposed to be 10.
Yeah. Yeah.
Okay.
So you can see, yeah, you take a circumference of an area or whatever, and that will give you a cross-sectional area.
And you know what's amazing? It must have been so small before because...
You got better, right?
Yeah, because
Yeah.
I was like, oh my God, I can breathe
It
now.
definitely
I can
was
put
night
my
and day with the way you're sleeping and
Yeah.
observing.
Yeah, so it has improved some,
Uh-huh.
but
You can't fit your tongue in it.
yeah,
no,
and
I
it's
get it.
miserable.
Yeah, I get
and
it.
I can't,
Yeah.
like, Kendra keeps saying there's supposed to be this suction and a sling feeling, and I'm like, I don't feel it.
I get it. No, I hear you.
Yeah.
I hear you loud and clear. Let's go back to them and continue discussion.